while we work to reduce the spread of COVID-19 by wearing a mask, washing our hands, and social distancing, there are still people getting sick. So we wanted to take another look at the process to see who should be tested and how it all works.
We may reach a point very soon where we don't test people that aren't high risk or don't necessarily need a test.
Since March, the CSRA has seen more and more COVID-19 testing, and with that, both negative and positive cases. While we don't deal with bumper-to-bumper testing lines, hours-long wait times, and packed-out parking lots, there could soon be a line drawn between who gets the nose swab decision maker and who does not.
Those are exposed and not symptomatic. I think it's nice to know, and it may be used to shorten the quarantine period, but it's not an absolute necessity.
Augusta University provides majority of the region's COVID-19 testing. You call and are scheduled a few days out. Dr. Philip Kuhl says people with symptoms such as fever, congestion, cough, runny nose, and even gastrointestinal issues should take a test, as should anyone who has been in close contact with someone who tested positive for the coronavirus. 3 feet for 3 minutes or within 6 feet for 15 minutes. AU will charge your insurance, but there is no copay or fee for those without insurance. The Families First Coronavirus Response Act, passed on March 18th, guarantees most people will not pay for a COVID-19 test as long as there is a public health emergency. And at AU, the results won't take weeks like most places, but typically 24 hours.
The advantage that we have is that we're running our tests locally, so we're not shipping them off to a lab. We're actually running them ourselves, and we have about 4 different platforms.
COVID-19 testing is also done in some Walmart parking lots, CVS stores, and the local health department. MedNow, a string of urgent care facilities run by Dr. Mark Newton, offers tests too, but results may take a little longer.
Testing did get down to where it was only a couple of days coming back. Now we're at about 4 to 5 days.
Dr. Newton says at MedNow and even Urgent MD, there was a surge and testing took longer. But he says LabCorp, the official testing site, is catching up. Unlike AU, people with or without symptoms and even people who were not exposed are encouraged to get a test.
If we just wait for them to have symptoms, there's just so many people that don't ever have symptoms. We would be missing out on those who could donate plasma and be an important role in avoiding another shutdown this winter.
MedNow has done more than 10,000 COVID-19 tests, and like AU, they charge your insurance, but there's still no copay or fee for the uninsured. While the interface is improving in order to deliver quicker results at MedNow, Dr. Newton is hoping for the fastest turnaround that already exists.
I'm pretty confident sometime before long we'll have access to those machines that currently are going to hospitals and nursing homes with a 1-hour turnaround. We don't want to get in the way of them getting what they need so that they can keep our medically fragile and vulnerable populations as safe as they can be. So